Program Collaborative Monthly Meeting. That's a mouthful. Welcome, and this is our time to go through what's going on with all of us collaboratively in the state and also do some updates of funding opportunities and other things as needed. So what I'd like to do first is go around and find out who else on the call for our minutes. And I'm going to start with, this is Lindsay McIntosh with Consortium for Older Adult Wellness and also chair of the collaborative this year. And also in the office with me is
Mary Pat Gallus, Director of Implementation for COA. Joni Saunders, Program Coordinator with COA.
Cheryl Wakefield, minute taker.
Cheryl,
Cheryl Wakefield,
minute taker extraordinaire. Okay, and who else is with us? Lindsay, I heard you on the call.
Yes, this is Lindsay from Central Colorado AHEC. Good morning, everyone.
Good morning. Glenda Mitchell with the Center for African American Health.
Hi, Glenda.
Good morning.
Danica Schiff with the Center for African American Health.
Hi. Welcome back.
Good morning. It's Melissa from Boulder County Area Agency on Aging.
Hi, Melissa.
There.
Susan, I heard you too.
Yes, Susan Milligan, University of Colorado Health, and retired, but still active.
We got to talk, Susan. Josh caught me up on some of your conversations, so I'm going to send you an email and get us set. I thought you were doing a training this week.
Well, I was supposed to go to Grand Junction to do a training, and they didn't. Something happened that they had to cancel.
Oh.
So it's scheduled for August, mid-August.
Okay. Okay. Great. Well, we'll catch up with that. And who else is on the call?
And this is Crystal and E from the Southeastern Colorado AHEC. Hi there.
Hi. And Holly, are you on the call? Oh, okay. Ellen, are you on the call?
Ellen took a couple days off.
Oh, good for her. Is Flora on the call?
Yes. This is
Good morning, Flora.
Martinez from CDPHE. Good morning.
And is Connie on the call?
Yes. Hello.
Good morning. And who else have we missed?
This is Lucy. Hi.
Hi, Lucy.
Good morning.
From the Colorado Neurological Institute.
Yes.
And Samantha Decker with Tri-County Health Department.
Oh, great. Hi. There's a voice we haven't heard in a while. Welcome back.
Thank you.
And have we missed anybody? Okay, great. We're all here. So I know that a couple of folks have other conference calls and things to get to this morning. And so what we're going to do is kind of move our agenda that we sent you around just a little bit. Just want to encourage those of you who haven't been on the calls before to feel free to ask questions and also reach out outside of the call. We'll be happy to do whatever we can to be of assistance. And we may have some folks joining us late. We'll try and catch them up as we move along. But the first thing we want to do is I'm going to ask Lindsay Blackwelder from Central Colorado AHEC is going to give us an update on where we are with one of the funding opportunities we have that we're working with now, which is the grant process that we are closing in on, final numbers. So Lindsay, I'm going to turn it over to you.
Thanks, everyone. So as Lindsay said, we are working on finishing out year 2 of some funding that we have through the State Unit on Aging. And our goal was to have 300 completers by August 31st. And I'm very, very happy to announce that as of the end of July, we have had 268 completers.
Yeah, that's good. Clapping on it. Yeah.
Absolutely, and that is such an improvement over where we were in year 1. So very, very proud of all of our efforts. Thank you to everyone. So, and remember that we did get some carryover funding for an additional 120 completers. So the first goal was to reach that 300 by August 31st. And then we had some carryover funding for an additional 120 completers to reach by August 31st. Now, I've signed some MOU addendums with some organizations, and they're working very hard on helping us reach those additional completers. So I have no doubts that we will definitely reach 300. I know that there's a lot of series going on right now that will be completing the middle and the end of August. So I know we're going to reach our 300. And I'm really confident that we're going to really reach deep into that 120 of those additional participant completers. So again, thank you to everyone. Please continue to get that data sent to the State Health Department and then get me your reimbursement. It's been fairly smooth now that we've been moving on in the process, but does anyone have any questions before I talk a little bit about the third year of the grant? Are there any questions regarding how we're going to kind of wrap up year 2? No questions? Okay. So I think I've spoken with almost all the agencies, and those that had met their numbers, we were able to sign MOU addendums. So if you have any questions on that, let me know. But I think most people have got those addendums in place that wanted them in place and are working on helping send down that 120 carryover funding. And then some organizations are completing series to reach their original goal of the 300. As far as year 3, Connie will have more updates regarding timetables, when we might see that money, when we might get all the contracts in place. What I'll be doing so that we are ready is during the month of August, probably middle of August, I'll just start reaching out and asking, what do you think your series, your completers are going to be like from September 1st, 2014 to August 31st, 2015? That way we can kind of have a sense of which organizations are projecting what kind of numbers. Now, we won't be able to sign any official MOUs until we here at AHEC get our award notification from State Unit on Aging regarding how many completers we're going to have. But I'm definitely going to start that process in August so we kind of have an idea of who's projecting what numbers for the third and final year of the grant. The MOU process is going to be nearly identical. I don't really suspect any changes. There'll still be the component in there about all lay leaders watching the HIPAA webinar and then all lay leaders signing the non-disclosure form. So that won't be changed. Everyone's kind of suffered through that in year 2, and I think everyone's kind of on board with that. So that'll be the same in year 3. I suspect the MOU will be very, very similar. I'm hoping it's a very smooth process. Does anyone have any questions regarding year 3?
I do. This is Susan.
Yes. Hi, Susan.
So by the time the MOUs go through every year, we lose all of our fall classes.
Yes, we have. The past 2 years have been very frustrating.
And, I mean, that's a real big frustration for us because that's a big time for our classes.
Absolutely.
And so what do you anticipate then for 2015? If the MOU isn't signed till January, which is what had happened typically in the last year or two, what do we do about those fall classes?
Well, unfortunately, like we've suffered in the past 2 years, if we can't get that funding at AHEC and get MOUs signed with you guys, we can't go and back pay for those series. So the true hope of everyone is that we get that in place in a much more timely manner this year. That information is going to have to come from Connie because I kind of have to wait on that state process. And I know Connie's going to report on that when she talks. Hopefully she's got some more updates for us. But unfortunately, if we can't get the funding any faster, then we can't do anything about those fall classes. And I know that's a huge frustration for everyone, and that's why we've kind of been behind in reaching our numbers. If we were able to count those fall classes, we would easily be over 300 right now and probably have most of that.
We would have been over 420 by now with what we know that people,
Yeah, it's very, very stressful for the organizations. It's stressful for everyone. And I really hope we can do a better job this year because we need to reach those numbers in year 3 of the grant, and we really need that funding in place in the fall. So I hear you, Susan. We're going to do everything we can, and hopefully Connie can give us a better update regarding how that might go.
And let me just thank you, Lindsay. And just a quick comment. I think also what has to happen is it has to come from the federal level, and I know Connie will talk about this. So it isn't just how it gets generated at the state level, but Connie's at the mercy of when they get the contracts to her. So, and every year we think that it's going to start in September, and every year it is later. So one of the things that we as a group talked about last year, and for those of you who weren't involved, if it were me and I were planning my my funding, I would not count on fall classes getting reimbursed. I just wouldn't, because it would be a happy thing if we have it in place so those classes can be reimbursed. But realistically, we have 2 years of data telling us it's not going to work that way. So as you're planning your budget, I would not count on reimbursement for fall classes, even though we're optimistic it's going to go differently this year. I would just plan on your fall classes being funded a different way, and the January classes being something that you can turn in numbers for toward this grant. That's just that's my voice of experience, because we've lost a bunch of those numbers too, and I know it's frustrating. And maybe what we can do in another call is talk about some ways to leverage that funding, and to talk about it now, how to help leverage funding for fall classes without this reimbursement funding.
That's very well said, Lindsay. And again, it is a very long process, many, many layers. So I know Connie will give us an update. Does anyone else have any other questions for me regarding finishing up year 2 or maybe MOU process in year 3?
Lindsay, this is Crystal from SECAHEC. So if the MOUs are not signed and in place, then do we need to submit data for any classes that may be held if we're not getting reimbursed?
Great question. And the answer is yes, we would love you to. The reason being is because we're still trying to create this statewide picture of what does CDSME look like across Colorado. And it looks kind of awkward if we don't have any fall data. So we would love to have all the data all the time, even if you're not doing reimbursement. It helps Colorado as a state when they are applying for funds through NCOA or other organizations. We don't want a gap in our data. So yes, please, please, please submit that even if you're not getting reimbursed.
And that is something we all agreed to as collaborative members, that we would submit that data. And it was an agreement that was made even separate from any of the funding things we've done. So,
well, and I figured that was the answer, but still just to get it out there to make sure that, yes, that is correct.
Yeah.
For the new folks on the call.
Thank you, Crystal.
Thank you.
Lindsay, is the data only submitted to the state?
Yes.
Or who else?
It goes into the state, into CDPHE, and they then give it on to the NCOA.
Just to the state then, okay.
Yes. And you're going to send the class information to the collaborative so we can get it on the website, but the actual data goes to the state.
Okay.
Lindsay, I want to say thank you very much for all the juggling, because I know you've been playing numbers and paperwork with us all year, and we appreciate it.
You're more than welcome. Thank you, everyone, for helping make it as smooth as possible.
Any other questions for Lindsay? Okay. Well, then, if anything comes up later, we'll let you know. And I know Lindsay has to drop off the call early, so if we miss you, Lindsay, thank you again, and we'll shoot you any questions that come up. And I'm going to turn it over to Connie because she's got some updates not only on the AOA grant, but on some other things that are sort of related to that. So, Connie, take it away.
Thanks, Lindsay. I keep saying the same thing, unfortunately, about the funding status, because we, despite being asked for a budget a few months ago, which made me optimistic and excited about the possibility of having definitive answer and paperwork from Administration on Aging in order to get things started. September 1, I don't have that approval yet, and I certainly can't predict when that would happen. You know, people think at the federal level that it will, and there's so many other people involved, and whatever process is used to get things to our level, I don't know when we will get that. I'm hoping it will be soon, but, you know, so are all of you, and I have absolutely no influence on when that happens. So beyond that, there are two mitigating factors from that would, one, put us in a better place and one that could delay it. So at the state level, as I mentioned before, I think that this is confusing, I know, but from the contracting perspective, we put some things in place last year to make it quicker for us at the state level to work out our contracts with COA and AHEC. So that could be quicker. It does depend to some extent on when we get the notice of award from the federal level, because anyway, we might be able to keep things in place longer if we get that notice. And I apologize, without going into all the ins and outs of our contracting process, which is not that interesting to hear about. We may be, anyway, we'll be in a better place once we get that. We should be in a better place because we created some options with contracts to make that quicker. However, on the other side of it is that we have a new contracting, procurement, accounting, et cetera, process in place, system in place statewide, as mentioned before, which could delay the process a little bit. So, you know, that's the nutshell version of where we are with that. I don't, you know, the first step is for us to get the go-ahead in terms of paperwork from the feds. I don't have that yet, and so that's what we have to wait for. And beyond that, we'll do the best we can, as we have in the past, to get things moving as quickly as possible. I have a question for you all, because I would not, as Lindsay McIntosh said, I would not, at a minimum, I would not count on anything starting September 1, since we're already into August. However, I have a question for whoever wants to respond as to, just for my information, what would be ideal and what would be the latest dates that you could comfortably start classes in the fall and think that you would get people to participate, because I know the holidays and winter are factors in that you've mentioned before, and being able to recruit people. So ideal, I suppose, would be September 1. So maybe let me just ask, what's the last kind of dates that you think you could get classes started and get people in the classes this fall?
Connie, this is Crystal from Statewide, and for us, I think it would be October 1st. So then we can do the 6-week courses and have those done before holidays and before Thanksgiving. So for us, I think October 1st is what we would shoot for. October 1st.
And this is Mary Path from COA, and right now we're looking at classes starting about mid-October, around by October 15th. That will, we've actually even set some, so they will finish up before, especially if they're not Thursdays. They finish up by the end of November, and those seem to work, but we don't want to start any classes after November 1st.
Yeah. Okay, that makes sense. All right.
From Colorado Neurological Institute, I would say starting no later than the 1st or 2nd week of October as well. Just once you get closer to Thanksgiving, it just doesn't make sense.
Right.
Don't come.
Okay. I assume that's approximately the same for other people. So, like I said, I can't control when we get the federal approval, and that starts the ball rolling, but that's helpful. Thank you. So the other two things I wanted to talk about were the sustainability consultant and the meeting that we're planning for late August. And then the second thing is the AmeriCorps grant that I talked about last time. I have some clarifications for you and a little bit of update. So on the business and sustainability consultant, we have selected someone. We tried, I sent the proposal request to 4 different organizations that I had been that had been suggested to me, and out of 4 we had 2 proposals, and we had a panel of people who were involved in reviewing the proposals and providing input, and based on that we selected the Maryland Nonprofits. That is an organization that helped the state of Maryland develop their CDSMP sustainability and business plan, and I looked at that and I liked that. So the 2 parts that they focused on were developing some statewide, state-level strategies, but also working with local license holders to provide some assistance and suggestions on developing local sustainability plans. And I've been told that you all did that through the ERA grant as well, but since that's been a while and there's a lot that I think can be done at the local level that sometimes can't be done at the state level or can't be done as effectively, that seemed like a good approach. So that's one of the things that people liked about their proposal. Also, the person that will be working with us most closely is someone that used to live in Colorado and has done a lot of consulting with different health organizations and social service agencies in Colorado. So, and she got amazing reference letters that were very positive and specific about things that she had done for different organizations. So I'm excited to work with them, and I hope that you all will really enjoy and benefit from their involvement.
I think this is really good news, everyone. They're wonderful. So thanks, Connie.
Okay.
Been decided upon?
That's the next thing. We had the best 2 dates that I asked you all to hold, and not everyone was available those 2 dates, but we had the largest number for those 2 dates was August 28 and 29. And the Maryland Nonprofits, unfortunately, is not able to be here in person for those dates, but here's what I would like to suggest is that I'm working on, I'd still like to do an in-person meeting, and they can be involved at a minimum by conference call, but I'm hoping we can work out something where we have a video teleconferencing so we could interact with them and see them, or just at least Wendy, the person who will be working with us, and then have some, visual interaction that I think makes, kind of accomplish what I was hoping to accomplish with having you all sort of, virtually meet her and have a discussion and interaction. And I talked with Lindsay McIntosh yesterday about the possibility of suggesting and asking you all what you would think about using that time, since we talked about the desire for various ones of us to meet in person for the collaborative meeting, maybe once a year. And this would be a time where we could do that. Even though the consultant won't be here in person, we could switch the August meeting to the August 28-29 time slot, and then just cancel the September meeting. It's only a week difference, and this would allow us to use the funding that I have for mileage and travel for you all during this grant year, so we could still pay for your travel in here for those of you who are outside the metro area. So if we were to do that, our options, and I'm not going to query everyone right now about what your preferences are, because that would take too long and we don't have everybody who might come on the phone. But the options would be starting the meeting Thursday afternoon and then finishing up Friday morning, which would probably be better for people who might be traveling in. Or we can do just all day Friday the 29th. Then people who are traveling, have to travel after we end the meeting, which I would think we could do by 4-ish, or maybe shoot for a little earlier possibly. But I will send out a query about that to see what would work best for the largest number of people, and then we could go with that. But and I guess, Lindsay, do you think I should just query people as well about whether that would work for them to do the conference or collaborative meeting then versus in early September, or should we just go with that? We did have 10 people who said they were available on Friday the 29th and 9 on the 28th, so that's kind of representative of, and it's a kind of representative of the number of people who usually are on the conference call.
I think we could go ahead and just assume that we're going to do the September meeting on, say, the 28th, and because it's supposed to be a Thursday next time, and then we could always, we can record it as usual, so if people can't make it, and we can have a call-in number as usual, so that we're kind of covered. The question would be whether we're going to try and do it at the same time as usual in the morning, or whether we're going to try and do the meeting in the afternoon so people can travel in on the 28th. So I think we still have some decisions around that, but I'm fine with moving the September meeting back to that last week. I think that works to maximize our time together and stuff. So, and we'll talk. We'll definitely talk more about it later in the call, and then I know Connie's going to send out something, email to everybody, so we all get a chance to weigh in on what we think and ideas and that kind of stuff. So,
just so you know, the consultant is only available the 29th, and if there's of course the other caveat is that we have to get all of the approvals in place in order to hire them. We've selected them, but they can't start working on things until we get the paperwork approved and all that. So there's always a chance that that will not happen by then, in which case we would still have the time, and we could use the time for a regular collaborative meeting, but expand it into some other topics that might be higher level, and maybe look at ways of starting the discussion about sustainability among ourselves. But it would still give us that opportunity to meet in person, which people have said has been helpful, and we haven't done for a year and a half.
And Connie, even if the consultant, Cheryl just asked me this question, which is a good one. Even if the consultant, even if the consultant is not available, the travel in for the meeting would still be covered,
right?
For participants in the collaborative, right?
Yeah, I think the way I presented in our budget is for a sustainability kickoff meeting. I don't think the feds are going to scrutinize that too much, but I would like to use that time for some of those discussions because I think there's things that we can start talking about.
Yeah, we could also spend some time on some of the work that around referral processes and some of the other pieces and parts that so that we're not interjecting too much in what the consultant is going to do, but we could also talk about some of the possibilities of sustainability that we've already looked at and some of the best practices some of the partners are across the state are already doing. So,
and I think like there's been some discussion about marketing issues and the confusion about having a lot of different names for CDSMP that does make it difficult to market statewide. So we could start a discussion or have a discussion about that. Things like that.
This is Crystal from Statewide. I know that last week of August we were planning on having a leader training. So as soon as you know if the consultant is available, it would be helpful to us so we know how to plan. I would think if the consultant is not available, then we should just keep the September collaborative meeting in September when it's scheduled. That would be my thought, but I don't know what others think.
Well, as we were discussing, the funding I have for the in-person meeting right now is through August. So I'm not going to, I already know the consultant is available on the 29th. What I don't have is the approval process, and since we just selected that person, or that firm, we're just starting that process of our clearance procedure that goes on here. So I'm not going to know that for a while. I was hoping people would hold on to those 2 dates, and I know it's hard to do that, but yeah, that's, I mean, it's really hard to accommodate everyone, so I don't really know what to suggest about that, or if, you know, Lindsay was suggesting going ahead and switching it. I'm sure that's better for some people and worse for others. I'm not sure what to do on that.
Yeah, you know, this is Eve at Statewide. We totally understand your dilemmas. We know that it's really, really difficult to do these things, but we just thought we'd throw that out there because we're struggling over here too, trying to get our schedules together, and we are on such tight schedules sometimes. We're kind of, it's just, I think we're all on the same boat, honestly. So we just thought we'd throw that out there.
Yeah. Well,
so how about we table this part until Connie has a chance to send out the query to everybody, and we'll see what happens. And then I know that the big question mark is the consultant available, and will we get through the contract? So that, I think, is to be decided.
Yeah.
And I know you'll, and we can all send you our input too, right, Connie?
Yes.
Yeah. Okay.
I mean, I do feel bad that everybody's, you know, went through all this process. We've been talking about this for months, and so I'm trying to make good on what I hoped we would do, but you know, it's just, I just can't predict when we would get that approval, or if we would get that approval. You know, after it's in clearance for a week, I might have a better idea, but again, when somebody's out of the office and is the next level of approval, then, you know, it is on hold until that person's available, so. It's a lot of, you know, if this, then that kind of a contingency planning.
Yeah, we definitely got that. Yeah, yeah. Well, I say let's move on and maybe talk about because we're going to have to come back to this clearly when we have more input. So how about can you give us an update on the AmeriCorps stuff?
Yeah, and just one last thing on that. On the meeting is that I really hope that everyone, because we've wanted to have this in-person meeting and because we have money available to reimburse travel for people outside of Denver, that everyone would make an effort to come in. I think it would into the metro area, I think it would pay off. But if there are people who just cannot do that but could participate by phone or video, I am going to work with a video person here that works for DHS. And I'll have some questions for if somebody can't come in about what capabilities you have there, whether there's another site you could go to, the state site that has that capability that's near you where you could participate and be able to see people. So I'm hoping we can at minimum do that. On the AmeriCorps grant, I guess there were some questions about that, and then I have a little bit more information, but to clarify, it's federal money that goes through the state through the governor's office, and they oversee the process of grants, grant funding in Colorado. A lot of different types of organizations and agencies are eligible to apply, including the state, but for this grant, we think it would make more sense for a private nonprofit to apply for the funding, because whoever, if we were able to get that kind of grant, then that organization would be in charge of overseeing all the paperwork, which I've heard is there's a fair amount of. So at that statewide level, that entity would, that organization would get the grant and would be in charge of monitoring, overseeing payment, that kind of thing. So at the state level, it's, I don't think it would work to pay a bunch of different people. But that organization, and I did talk with the person at the governor's office yesterday, they said, there's no guarantee we get this, of course, but they would suggest that one organization propose overseeing this statewide. And as I mentioned last time, there's a fairly high level of expectations for the number of hours that each AmeriCorps member would provide. So it wouldn't just be for CDSMP classes, because you wouldn't have, based on the number of classes everybody's provided, the AmeriCorps members, which are kind of volunteers who get some amount of funding payment for their time, they wouldn't be able to do enough CDSMP classes to log the number of hours required. So it would be an opportunity to provide extra staff at the local levels to do a variety of other things, but including CDSMP, which is the way this conversation originated. Then the second level of that, so one organization would apply and coordinate this statewide, and then local entities like the folks that are, all of you who are on the line, would be potential beneficiaries of this, in that you could have people that you would hire, or a person that you would hire at your level to do this kind of work, to run CDSMP classes and do other kinds of volunteer things. We could also consider offering this to all of the area agencies on aging. There's a variety of ways that this could happen. But at the, I'm saying local level, what I mean is anybody other than the organization that would run the whole program. So if, for example, Crystal wants to hire someone there, then her responsibility would be to, and I'm describing this as best I understand it, there's more detail available in the grant application process, but we would define what the job description is and hire the person and oversee their work and make sure their timesheet got submitted to the organization that runs a grant. So at that level, it's not a lot of work, but that's where you would get the benefit. So I hope that makes sense. I'm kind of repeating because some things, not everyone understood what I was saying last time. So anyway, that's where that is. I found out that we haven't gotten an announcement of funding or request for proposals yet. They're kind of ballparking, maybe late, hearing about that in September sometime, maybe late September. And typically what the first step is people that want to apply for those grants submit a letter of intent. And my understanding is that the entity of the governor's office that looks at these selects people or organizations to go to the next level to actually submit proposals, which are due a bit later. Let's see what else I have on my list. I think that is pretty much everything at this point that I know, but it would be good for us to, that's one of the things we could also talk about at our next meeting, whether that's the end of September or end of August or first week of September, is organizations who among you might be interested in applying for that grant, and you know, how we go forward from there. There's certainly no, I am not saying that more than one organization could apply for it, but they'll only consider one. I mean, they would only fund one application. So if so anyway, that's, you know, it probably would help us if there was just one proposal submitted, but again, it's not, I mean, I'm not controlling that, and more than one person could apply. Are there any questions about that?
This is Susan Milligan. I do have a question for you. For this grant, is there a target age group?
For people that would be hired to be AmeriCorps?
That we would be serving through a grant like that. Is it over age 60? Is it, you know?
You know, I didn't look at that criteria before I got on the phone again. There are different categories of, let me see if I can find that. I might, I mean, that's a good question, Susan. And again, I just didn't have time to go over it again. Let me try to find it on my desk. I can clarify that a little bit more after the call, because I mentioned that last time that I could send out the last year's request, which I haven't done that yet, and I can send you the link to look at that, so that that would have some more, you know, all the detailed information that was provided last year, which probably be fairly similar this year.
So for the sake of time, how about if we just we can definitely do some send out some information with the minutes, some additional information, and since it isn't something that needs to happen immediately, we can also talk about it on the next call. And I'm thinking, Connie, if there are people that are on the call that want more information or are interested in applying, they should really reach out to you at this point, right?
Sure. And you know, the extent of my information is what was in last year's request, and then the conversations I've had with the person at the governor's office. I can read you one or two sentences that just two sentences about the category that this would fit into, which they have various categories like health. This is called Healthy Futures. There's veterans and military families, disaster services, economics, education, environmental issues, etc. So there are a number of different categories, but under Healthy Futures, they say grants will provide support for health needs within communities, including 1, access to care, 2, aging in place, and 3, childhood obesity. Grant activities will improve access to primary and preventive care for communities served by CNCS, which is, I don't know what that stands for, but it's related to the grant. Supported programs increase seniors' ability to remain in their homes with the same or improved quality of life for as long as possible, and then things about childhood issues. So I don't know if they define what senior is, but I would guess we could do that if they haven't already, but that's where this would fit in. It doesn't mention disabled, but disabled adults, but in that, I don't know if they have anything in here about disabled adults. That's something we could ask about. But at a minimum, seniors, and it fits perfectly with what CDSMP can help do is help people remain in their homes with improved quality of life for as long as possible.
Question, have we reached out to any of the local organizations like Boomers Leading Change in Health who have already gone through this process with AmeriCorps?
I have not, but that was a suggestion that I think you might have made last time, and also it was referenced in my conversation with the governor's office. What are you thinking that just they might have some help with suggestions and their experience and things, or?
Yes, their insight on how they were able to navigate through that whole process, and I know they're into about their third year, I think.
Okay.
Working in that realm.
Do you have a contact in particular you would suggest?
Yes, I do. I can certainly get that to you.
Okay.
Susan Daly Keller. I can email you her information.
Okay, that'd be great. I'm sorry, what was the name?
I can email it to you.
Oh, okay. I thought you said who it was. Anyway, that would be great, yeah. And I'd be happy to do that and see what other information I can provide.
Okay.
And again, I will email the link to last year's proposal request. Any other questions about that?
Let's see. I might have her number here. It's her telephone number is 303-4-BOOMER, and the name is Susan Kaler Daly.
Okay, great. Thanks very much.
You're welcome.
So, last call for questions for Connie. Okay, and we'll do an update on all this next month and in between too if other things come up. So,
okay,
great.
And I'm gonna tap out here and check out this other conference call that Kate Lorg, who originated this program, is doing, and then if it seems like it doesn't apply to me, I will pop back in. So, okay, thank you very much, everybody.
Great, thanks, Connie.
Right,
We'll talk to you later.
Okay, bye.
Bye, Connie. Okay, let us keep going through our agenda. One of the things we wanted to talk about was just we're kind of flipping through here. One of the updates we usually do is from regarding data from our friend Flora at CDPHE. And so, Flora, I'm trying to get to your slide so people can see, but why don't you go ahead and give us an update?
Oh.
Or do you have an update?
I don't have an update. I didn't know if that slide was for the graph.
There you are, there you are. I know, I worried you with the bar graph, didn't I?
Yeah, I was like, that's not my presentation.
Oh, no, I wouldn't do that. Yes, explain this to us, Flora. What does that slide mean? No.
No, everything's going just as usual. Everything's great. Thank you all for submitting your data. So we're getting that consistently, and we're not seeing any problems. So I meet monthly with Lori, and she's the one who actually does the data entry, and I do the QA on it. So if I hear anything from her, I'll be sure to contact you specifically if it applies to you, or bring it up on the next call.
Great. Well, will you tell Lori we said hi?
Yes.
Okay. Anybody have questions about data, or anything related? Wow, that was a quick report. Okay. Thanks. So I just want to go over, if I can get back to the right spot, where we are with our centralized referral system. We don't have a lot that has happened this week, and I'm going to look at Mary Pat in case she has anything she wants to help me with on this. Just so you know, for those of you who missed the call last month, we do have 2 leaders who came from a presentation that Connie made, and they heard about it through the network, and then they found the website, contacted us through the collaborative website, and they've now been trained as leaders, and they're going to be working with a rheumatology clinic doing classes on site for folks with rheumatoid arthritis and lupus. And one of the 2 leaders, that's their chronic condition. So that's very cool, and that happens through the centralized referral system. We do still have clinics that are referring ongoing. We have a total of 15 different providers who have sent us referrals. And what we are finding is that we are seeing some real uptake in some interesting areas. For example, Physician Health Partners, which is one of the RICOs that we presented to. They have now trained people, are doing classes within their clinics. They're in the process of setting those up. They're doing an actual real-life referral system of their own, and then we will help support those folks that can't fit into classes that they're doing at their facilities. If I got that right, Mary Pat? So they're going to have, they have 14 leaders, so in all of their various locations, they will have classes. And anyone who does not fit into that scheme will hopefully be able to get into a different class.
Correct. And then also anyone in the general public that wants to be referred into those classes, that's also.
Oh, great. So they're open to the public too. Cool, cool. So that's very exciting. So what is not referred, or what is not on this little page that you see, are the Physician Health Partners attendees, because those classes have not started yet. They did one referral to us, but they've been holding on to them because they're going to want to do them inside. So they are, so they're going to be working with that. So that's what we know, and we are still working on that. This is just where those folks attended. We did have some people that went into Kaiser Permanente classes. As probably you know, we are working with Kaiser Permanente and hosting those classes for them now. We had one person went to the Boulder AAA. We've also had some folks that have that went through the pain program with Susan Milligan up at University of Colorado North. And part of what we had asked last meeting, and I'll just restate it again, is that if you get a referral from us, let us know what happened. If we send you somebody that wants to take a class, let us know how it happens and what happens and if they complete. Because that's part of what we're trying to track. So we are hopeful that, oops, then I went back. we are hopeful that we are going to be seeing more in the coming months, in part because we are really waiting for Dr. Cobb to start kicking in on some of the classes and things they're doing. And we also know Sue is still working with the referral system through Mesa County. So that's what we got on that. Any questions for me on any of that stuff? Okay. So we also,
Hey, this is Melissa. I have a question about the referral. So I remember that I got one from you guys, and I think they didn't end up signing up. I did not track it. Is there a way to, like, do you, I can't remember what happened. I don't remember whether you actually sent me an email saying this person called you or how I got it, but I need to do a better job of tracking if that's what you want us to do.
Yeah, what we do is if they send us an email, then we can let them know we're referring the email on. But usually, usually for HIPAA compliance, we either have to fax it to you or we have to call you with the information. And I don't know how we sent it to you from this. I'd have to go back and look. And it's been a while.
I don't remember.
Yeah, but it's just, you know, we're keeping all of the numbers we can so that we can show what's happening. And then what we need to know is just, did you contact them? Because we're assuming that you contacted them. And what the upshoot was. Did they attend class? They didn't attend class. They needed a class at a different time, whatever.
Okay.
And then you can, to be HIPAA compliant, then what you want to do is just email us back and not reference the person by name. You can say, the referral you sent me, here's the update on it. So that's all we're needing to track. And so you just told me you don't think they went to class, so that
I don't think they did, but I'd have to go back and really get a reminder from you. I don't believe it worked out.
Well, you know, the plan is also, in terms of long-term work, that if it's the reason that they couldn't go to class is just because of the time and the date of the class started, that we want to kind of hold on to that information so that the next time we have a class series starting or somebody else has a class, you know, say Kaiser's going to have a class up there, which I don't think they will, but let's say Kaiser's going to have a class, and this person that we referred to you couldn't attend your class, we would then want to be able to get them into a Kaiser class or University Family Medicine class or something else. So that's another reason to let us know the follow-up on it, just so that we can do everything we can do to get them in a class somewhere.
Okay, and so that would be your responsibility, that if we tell you that it didn't work out, that you would be in touch with them, not us being in touch with them about other classes.
Well, if you have other classes and you think that they will be able to go to one of your other classes, then great, hang on to it and call them back next time you have a class set. If you don't, if it's something that they want a class right away and you've already done your classes for the year, then let us know and we'll plug them into whatever we can.
Okay, thank you.
Sure. Any other questions or comments? Okay, cool. As usual, it's still just a work in progress. So just a couple of updates on the training. I know Pueblo has training coming up the 25th through 29th. And Crystal or Eva, you want to tell us, do you still have spots available?
We do. We do have spots available. You know, trying to, our dilemma is in how we make these connections and solidifying them is depending on everybody's schedule, and there's so many schedules that, you know, as we previously said, scheduling is difficult. So, but yes, there are spots available.
Great. Great. Okay. And so if anybody has anybody, they should get in touch with you.
That would be great.
Okay.
I have a question. This is Mary Pat. Are you still going to hold the August 25th through 29th dates, even if there is that collaborative sustainability meeting on the 29th? I just want to know if we should refer potential leaders.
We are trying to decide internally if we are. I don't know that we received the communication for sure that the sustainability was the 28th and 29th. And we've had our leader training on this book for several months. So we need to have a conversation internally.
Sure. Okay.
So with one of our coworkers, so we can get back with you if you have people in mind.
I don't have anyone in mind, but it does intrigue me. I'll say that potentially we could for that Pueblo training. So I didn't want to make contact if you're still not absolutely sure. That's why I was just, because I kind of heard you say it was up in the air a little bit, the date.
Yeah, because with the potential meeting at the end of the month with the collaborative.
Okay.
So,
And
I guess once we hear back for sure from Connie, then we can make the determination what our plan is.
Okay. And there is a big, I think she said this, but I'll say it again, there is a big question mark whether they can get the contract in place in order to be able to do that. So it's kind of a moving target for all of us. And I definitely heard what you said about keeping the date. If everything is off the board for August, continuing on with our September schedule. So,
but then I think I overlooked the fact that for the in-person meeting, it needed to be done by the end of August.
Yeah.
So we need to have an internal discussion, and then we can email Lindsay, and then you can disseminate it out if that's okay.
That works. That works.
Okay, thank you.
Yeah. Okay. Thanks. And then Susan Milligan, you said that you think that they've moved the dates for the training that was going to mid-August.
Yeah, it's August 19th through the 22nd in Grand Junction. And Susan Audrey Hilltop is the contact person. I know they still have openings. And if anybody's interested, her phone number is 970-773-2234. And I'm confirmed for that training, so I'm going to go do that. And then the following week, we have one scheduled in Rockland.
Is that your chronic pain?
No, this is just CDSMP, and that's the 25th through the 28th, and we already have 16 people. So that's like full.
16? Wow. And that was August 25th through 28th?
Yeah.
Okay.
Where is that going to be at?
Where are you doing that?
When?
Where?
Where? We're doing it in Loveland. We have an office building out there at Rangeview. So that's where we're going to do it. So we've got people coming from Estes Park, from Sterling, Boulder, quite a few.
Wow.
I know.
Congratulations.
Can you tell me who's coming from Boulder? Would that be something you could share with me? Because I wonder if you'd be interested in doing some teaching for us.
Yeah, I can, but I don't have that in front of me.
Okay, are you still at the same email address?
Yeah, go ahead and send it to the same email.
Okay, I'll just send you an email and we can do it that way. Thank you.
Yeah, there's 3 or 4 people from the Boulder area.
Really? Okay, great. Thank you.
And 1 from Denver.
This is Mary Pat. Is the one in Grand Junction free?
Yeah.
You know?
Yes,
And,
it is.
okay.
And who are you going to be co-training with?
Mary Holman.
I'm sorry?
Mary's the master trainer up here.
Oh. I thought Jean was doing it, not Jean, huh? Okay. Jean Uppin was originally going to do it, so, okay.
Well, there was somebody who was going to do it. We were going to do it this week, actually. And,
Yeah.
And she had to back out. That person had to back out.
Okay, that's probably Jean.
That was
Okay.
like August.
Okay.
So, Mary Coleman.
Mary Coleman. Okay, great. And then when will you give us the dates again for, do you know the dates yet for the chronic pain?
No, because I need to do that with you.
Okay. I thought maybe you had set the date already. Okay. That's good. I'm glad you are saving that.
So I'm waiting for you.
Okay. Well, then we'll talk. So we know we're going to do a chronic pain training, leader training, and we're going to use our existing master trainers in the state. I was planning on training some chronic pain master trainers, but they're redoing the curriculum, and so right now we can't get new master trainers certified. So we're going to do this with Susan and her cohorts and do a training, and we have a lot of interest in that program, and so I'm really excited. So thank you for doing that.
Lindsay, are you a T trainer then? You can train other master trainers?
When I said we, I meant COA.
Okay.
And what we'll do is we will work with, when we get to the point of getting master trainers, what we'll do is have the master trainers that we already have cross-train with Stanford. So there'll be, for example, chronic disease, self-management leaders, and master trainers. They will then cross-train to become chronic pain master trainers.
Which is what I have done.
But you guys will train through Stanford to be master trainers? Because you have to have a T trainer to train a master trainer.
Yes, I understand that. That's if they come out and do it here as a class. If you are already a master trainer, working under somebody's license, you can work with Stanford to cross-train with a T trainer remotely through Stanford.
Okay.
And then you can get a second credential. So, for example, Josh on our staff is a master trainer in chronic disease and Mondo, and in the cancer, thriving, and surviving, and diabetes. Because once you're a master trainer in one, you can then work with Stanford to cross-train in others. In the same way that if you take a leader training, you can then cross-train and also do diabetes.
Right. Well, and we did that online to cross-train as diabetes master trainers. I just was confused when you said that you were going to be holding a training to get more master trainers. That's why I asked if you were.
Oh, no, I'm sorry. No, we're not holding the training to get more master trainers. We're holding the training for leaders and the chronic pain curriculum. And COA will be getting some of our master trainers cross-trained as soon as the new curriculum is available.
Okay, with Stanford.
With Stanford.
Okay, thank you. I just.
Oh, sure. Sorry about that. And Alamosa, I don't think we know anything about that training yet, do we? Okay, I'm going to assume no. Any other trainings we need to talk about?
Do you know anything, Liz, about the cancer one, where they're at with that?
A little bit. So just a little background. COA was involved with the University of Colorado Cancer Center, Stanford University, and Texas A&M in doing the translational research piece for a new curriculum. So it's based on Kate Lorig's Chronic Disease Self-Management Program, but this is what's called Cancer Thriving and Surviving, that is specifically for cancer survivors. And as part of the research study we did, we had the only license in the country at that point. And we worked with Dr. Lorig, and she came out and did a training. We have 3 master trainers in the state in this curriculum, and we trained leaders to do these classes. Now the research is done. They've written the results. They're working on getting those results published, which is all part of evidence-basing it, and then we'll move forward. Do you want to talk about what's happening with the training?
So what we're looking at now is we're in partnership with the university again for a phase 2 grant that was already submitted. We will hear in October of our partnership and how it proceeds. It would start January 2015. And that would be a phase 2 type of a research project that would require, again, more statewide leaders in CTS. And so really not knowing yet how that's going to pan out and what our agreement will be. We would be looking at something similar to what we did as far as implementing and reach of cancer survivors, but there'll be a different twist to it. It's actually direct referrals from clinics, post-active treatment, as opposed to all the different, phases of survivorship that we dealt with before. And so it gets a little more complicated. But we are hoping to hear something in October. We're optimistic, and we can give you more information once we solidify that. But there is included in that grant to train up more leaders, because we're going to have to do some reach in some targeted areas. Actually, probably up in your area with the university because of their IRB already, and down in Colorado Springs and down in Grand Junction and so forth. So stay tuned.
And we're talking with, in negotiations with Kate Lorig and Stanford, because we are waiting to get the green light to go ahead to be able to do classes, to be able to use our master trainers to train leaders for our state and other states as well. And how they have been working it so far is that Dr. Lorig is picking specific spots where they are doing research. I know they trained some folks in Massachusetts, I believe, Boston area, who were doing a program with a cancer program out there. So they did a little leader training and are doing something very specific, but there is no availability yet for us to train leaders to just go do classes. That has not been approved yet through Stanford. So that's what we know.
Okay, now I'm curious if we will need to do another leader update for to even teach classes.
If we do, we'll do something similar to what you worked on with Joni last time, so that we can, as far as I know, the curriculum hasn't changed any, has it?
We don't think so, and We think we'll be okay, Susan, as far as those existing leaders who went through the update like you and Laura did. I mean, we'll know more when we have the grant and what the guidelines are, but we're fairly certain we will not have to update those leaders, that we'll be able to just get you guys rolling out into classes.
The research came back saying that people loved the class, and it showed some similar sorts of movement to what we see with the other programs. So it fits into the same evidence basing that